I usually ask this on street, but I'll ask you, how much money doctors make in Canada compared to in India?
It's quite variable. Doctors make at this point of time anywhere between 300,000 to more than $1 million.
As a doctor, if someone wants to move to Canada, how does it work?
ਪਹਿਲੀ ਗੱਲ ਤਾਂ requirements take a long time. Exam challenging ਹੁੰਦੇ, tough ਹੁੰਦੇ. Then you're competing with people or doctor coming from all over the world.
To practice in Canada as foreign trained doctors, they must have an approved medical degree from a recognized university.
The Indian medical graduate can now practice in countries abroad, US, Canada, Australia.
There's no guarantee that they're gonna say yes after a certain amount of time. Okay, then now you're passed. Every year you're a new candidate. How many hospitals have you seen ki new hospitals are? Have you heard about ki new hospital?
None.
Never, right?
Yeah.
So it's a lot of money involved, maybe politics too, huh?
About 20% of Canadians have no family doctor at all, and many more have irregular access to clinicians.
Let's get into what is Botox, what is filler. I have so many people who went to Turkey
Yeah.
and to get this job done. I know
Yeah.
so many people.
First of all, it's a big umbrella. It's a huge business. Turkey, they're famous because they advertise it very well. There are a lot of skill set there, Hana. But now it's available everywhere. Botox, fillers, rhinoplasties. They're a little bit different things. But again, the goal is to make you beautiful, rejuvenate your skin and all that.
I've seen so many people, they get the boob job done, right? Of course, they work on their face a lot.
As I said, liquid rhinoplasty, which is like non-surgical nose job. Very safe procedure, minimal downtime, excellent results.
Varun bro, how are you?
I'm good. How are you?
Perfect, perfect. So you have been on the camera before as well? Tusi
Yeah.
ਪਹਿਲਾਂ ਕੀਤਾ ਹੋਇਆ?
Yeah.
Probably on the radio you said, right?
Did on the radio. I mean, yeah,
Otherwise-
live, mostly live kita hai.
Very nice. Varun bro, what do you do exactly for work?
I'm a family physician.
Okay.
I've been trained in Canada, of course. Grew up in India. My practice also includes working in emergency department as well. So I work like once a week or more often sometimes. I also do long-term care as well, which involve working with the elderly population. Other than that, I'm now involved in aesthetics as well, which we're going to talk about more today. Which Botox, fillers, we do non-surgical rhinoplasties, which is nose job, and a lot of other things, including PRP, and we'll talk about it anyways. So that's in a nutshell what I do.
And how long have you been living in Canada?
It's close to 10 years or more.
10 years and more. Before I get into the business, I'm really excited to know this. Ki anyone who wants to move to Canada as a doctor, hai na? Koi banda, I will switch to Punjabi a little bit because
Totally fine.
a lot of my audience is Punjabi as well.
100%.
And I really like to talk in Punjab, but kade English nikal aandi hai na.
Fair.
So, as a doctor, if someone wants to move to Canada, how does it work? Because from what I hear, there are a lot of challenges. There's a lot of study. Some people say that you have to study again in Canada to become a doctor. How does it work?
I like to split it into two parts. Hai na? You know, by ek part hunda is you're immigrating to Canada, right? Another part is your career. How, if you're a doctor, you want to work as a doctor. Hai na? Career part is different. So I want to split into two. I would say relatively, again, things change. Immigration part, I would still say is relatively easier. Again, मैं relatively तां कह रहा है कि things change. Nowadays, it's a bit different.
Right.
Back then, or last 10 years, 15 years, immigration relatively people, they're able to attain, achieve. Now, career part ਦੇ ਵਿੱਚ, as you listen कि हाँ जी, we need doctors in North America, Canada.
Right.
But when it comes to reality, it's way different. Now, why is it different is ਜਦੋਂ ਤੁਸੀਂ you're already trained doctor in some other country, ਤੁਸੀਂ ਆਪਣੀ degrees ਲਈਆਂ ਹੈਗੀਆਂ, as any other field, you have to get them approved. It doesn't stop there. You don't get the license right away. And again, it's very competitive, very hard. So they treat you, the system treats you like you're a foreign trained doctor. That means you have to go through exams, you have to evaluate your degrees, and then you have to get into do residency, which is MD,
Right.
after medical school. Je tusi already trained specialist ho, you still have to go through a tedious process. Now, there's a bottleneck. ਤੁਸੀਂ exams clear ਕਰ ਲਏ, you have completed all basic requirements, then you're competing still,
Right.
which means you're applying every year, which means a lot of money. ਪਹਿਲੀ ਗੱਲ ਤਾਂ requirements take a long time. Exam challenging ਹੁੰਦੇ, tough ਹੁੰਦੇ. Then you're competing with people or doctor coming from all over the world. Generally speaking, off the paper, there are some countries ਜਿਹੜੀ ਜਗ੍ਹਾ ਤੇ trained ਹੋਏ doctors that have little bit edge over people who are coming from, let's say, Asia, Bangladesh, Pakistan, India. Now, just as a reference, I'll give you like 52 seats on the BC ਦੇ ਵਿੱਚ every year for family practitioners as compared to 200 something for MD. है ना? So you're competing with all those. You're every year going through interviews or limited spots. If you're not matched, you're going to next year. So I would say it's less than 10% chance. Competitive हैगा. It's hard. Irony is they say need doctors, but they have limited spots still. Now things may change.
Right.
But that's in a nutshell the processes. Took me more than, I would say, 7 years to get into the system.
Like Canadian system.
Canadian healthcare system.
So like you were a doctor in India, right?
Yes, I was a fresh grad already practicing after my med school, which
Right.
you're allowed to do in India. It's your choice. You want to do MD, super specialize and all that. Here you need 2 to 3 years of residency, which is again specialization.
Right.
That's what I did. You cannot practice. You just come here and get the license. That's not how it works.
You see how them transfer ਕੀਤਾ ਇੱਥੇ, right? Oh, transfer to 7 years. So you moved here, okay? Now you moved here as a doctor. How was it like? Did you decide to doctor day one? Okay, I have to be a doctor. ਮੈਨੂੰ ਪੜ੍ਹਨਾ ਪੈਣਾ ਇੱਥੇ ਆ ਕੇ. How did it work? ਥੋੜਾ ਉਹ ਸਮਝਾਓਗੇ process?
Absolutely. So I think there are two questions. I would say two sub questions, right? My decision was okay. I was very clear. Yes, I want to be a doctor because I've been practicing. I don't know anything else.
Right.
I don't know how to do other jobs.
Right.
But obviously, you have to do it because you want to earn money, sustain, and all that. Yes, that was clear. As I said, there are basic requirements to get into residency and do all that. Residency, when I say residency, I mean medical residency, which is training. ਤੁਸੀਂ ਜਿਹੜੇ exams ਦੇ ਰਹੇ ਹੋ, ਤੁਸੀਂ English requirements ਪੂਰੀਆਂ ਕਰ ਰਹੇ ਹੋ, and which has to be up to date. Like there are a lot of things. I'm not going into details right now. So requirements ਜਦੋਂ ਪੂਰੀਆਂ ਕਰਦੇ ਨੇ, that does not guarantee that you are into the system. As I said, you have to compete for the spots to get into medicine. And you're competing with thousands of people who are similarly trained or even better trained. है ना? And then you're going through interview process and all that throughout Pan Canada, jate apply karde ho. You do not get any financial help from the government. It's coming out of your pocket and it's an expensive process. Plus the insecurity, or I should say, there's no guarantee that they're going to say yes after a certain amount of time. Okay, then now you're passed. Every year you're a new candidate. So that's the part that hurts. I have a lot of my friends or colleagues who were unfortunate and did not match because it was long time. Because longer you're away, ਜਦੋਂ ਤੁਸੀਂ graduate ਕਰਦੇ, the fresher you are, the chances are good. Again, that doesn't guarantee still. ਜਿੰਨਾ gap ਆ ਗਿਆ, and it's hard to fill that gap. It's taken as negative from their perspective.
I usually ask this on street, but I'll ask you, how much money do you or a doctors make in Canada compared to in India? Give us an average number, like a range.
Right. It's quite variable.
Okay.
Like any other business or any other profession, it depends on how much you work, what kind of work you do. Doctors make, at this point of time, anywhere between 300,000 to more than $1 million.
Okay.
Again, how hard you're working, what kind of work do you do, all that. I would say it's rewarding to be a doctor in Canada or North America. It takes a lot though.
It takes a lot.
Now, once you're a doctor, again, some people like to work 2-3 days. Some people still work 6 or 7 days. Again, there's a big range.
Right. Is there what do you say, a cap on the number of patients you can take as a doctor in Canada, like every day? Because in India, I've seen you can take as many patients as you want, like RN log, and they're coming in and going out, coming. But in Canada, I'm not sure. I think there is a cap. Is there?
Right. Great question. So as a family doctor, I think the other question, so how they structured it, because MSP pays for, that's part of the government, right? Or how you get paid from them. That's a billing process they created. So per day you're allowed to see X amount of patients, which the number at this point is 50. uh, but again, even if you see more patients, you don't get paid appropriately, meaning they cut your billing to next. Let's say you see 10 extra patients and the billing cuts down. They don't pay you 100% of per patient. So, I mean, again, I'm not going into super details because it's a bit complicated, but yes, there is a limit, there is a cap. Now, back during COVID, they took away that cap because everyone was struggling and people were not able to get in, and there was shortage of doctors. There were a lot of doctors who retired. So they transiently made that change, then they took away the cap. But I think the cap is not a limiting factor at all. It's ਤੁਸੀਂ ਕਿੰਨੇ number of patients ਆਪਣੇ umbrella ਦੇ under ਕਿੰਨਿਆਂ ਨੂੰ care ਦੇ ਸਕਦੇ ਆ. You often hear, oh, certain doctors have like a longer waiting time and all. It is because if you take so many people under your care, you'll be able to only see X amount of people, and you have limitations, time limitations, your overall health, how much you want to burn out or not. I think that's a reasonable number. It's not taking more patients under your umbrella is fine. There's no cap on that. So the daily cap, yes, it's there, but how many you can take, there's no cap. But often you will hear ki doctors can they, no, I'm done, I'm full. The reason is because the waiting times go higher and they don't want to take more burden. Right? And once you take somebody's care under you, you are responsible for them. Right? But there's obviously, you can stretch to certain limit.
Why do people think that, okay, Canada च doctors ਦੀ ਕਮੀ ਹੈ? And like even I think the same way, because ਮੈਨੂੰ ਲੱਗਦਾ ਹੈ ਕਿ whenever you go to these emergencies or anywhere, there are a lot of patients sitting outside and there is no one to take care of them. I mean, it takes time, obviously. It's time ਲੱਗਦਾ ਕਈ ਵਾਰ, and the bigger the city is, the more the mess is, right? Absolutely. Obviously, in smaller town it's different, but why are they not hiring? What's an issue? I mean, why are they? When you said kind of there are limited spots, right? Even though it is said that that they need doctors, there are limited spots. But what we see through the eyes, I mean, they really need people. Why are they not hiring?
Absolutely. So I agree that's a challenge, and we are in a crisis, honestly. Not the best person to answer ki why are they not hiring. Are they hiring? Are they not hiring enough? Maybe that's what the scenario is. You might have to see recently sunaya hona, oh, they have increased the number of seats for foreign trained doctors, and again, there is a process involved in that. It's not ki they hire, they're gonna say ki okay, you come. Still on they have to go through what you call it, they get assessed too, hai na?
Right.
So it's not ki they opened spots and they're limited spots still, but they still have to go through the process. They're under supervision for a certain time and all that. Again, not going into super details. There are a lot of bottlenecks, hai na? Bottlenecks कितने हैं या our system is government funded, है ना, primarily. Emergency departments हैं, offices हैं. I think the limited sources, as you said, ki doctors.
Right.
Like there are other things too. Now, kind of, if you look at last 10 years, population has risen a lot, है ना? Immigrants and all that. Canadian population कितनी grow हुई है. If you look Surrey, I mean the area we live in, Chilliwack, Abbotsford, it has grown. How many hospitals have you seen ki new hospitals आए? Have you heard about ki new hospital?
None.
Never, right?
Yeah.
So it's a lot of money involved, maybe politics too, है ना? So that's one limiting factor too. Policymakers, I don't know. I mean, I can talk on their behalf. Limiting factors in terms of ਜੇ ਤੁਹਾਡੇ ਕੋਲ ਇੱਕ hospital, let's say Abbotsford Hospital, emergency department, let's say there are 3 doctors working in a shift at one certain time, or in a day 5 shifts, let's say. Now they can only see certain amount of patients, you know? So that's why you see longer waiting times and all that.
How about like I see in India, there are government hospitals and there's a lot of privatization as well. Why are they not going in a privatization model? I mean, there are people I know who can actually afford making their own hospital and setting up the whole standard for Canadian living. Why are people not privatizing it?
Absolutely. So again, I'm gonna split this question into two. So privatization, what I hear from talking to different people is a double edged sword हैगी है ना.
Okay.
So ਉਹਦੇ ਫਾਇਦੇ ਹੈ ਨੁਕਸਾਨ ਵੀ ਹੈ. So what is a government funded program? Now what their debate is or what their rationale is, let's say ਆਪਾਂ ਇੱਕ hospital private ਕਰ ਦਿੰਦੇ ਹਾਂ, ਠੀਕ ਹੈ, and then people who can afford they're going to go to that. So resources कह लो कि distribute हो जाने and will be like discrepancy आ जानी. So people who can afford वो private hospitals let's say get treated. और resources तो होने की limited है, उससे pool चो ही सारा कुछ जाना है, right? Okay, as an example, a hospital visit you hear कि $700 तो लेके $1000 तक emergency visit एक बंदे दी है. I'm not talking about admission, I'm talking about a visit.
Right.
Even if you privately create those hospitals, कि वो सारा कुछ आप अपनी pocket चो कर सकते हैं as an individual, not everyone can afford it. There will be maybe less than 1% people, and they still have to put something out of pocket, the government. So resources decentralize ho jane. That's what their rationale is. Creating two systems is gonna cause problem on this side again.
But
है ना?
no, okay, I know this is kind of a debate, right? But let's say if someone is dying,
Yeah.
it's better to pay the money and not die if they have the money, obviously. Like in India, if someone is dying, they would actually call the hospital. They will try to get into good hospital or any hospital, private hospital, pay the money, and maybe the chances of them dying would be a little less. Here, if someone is dying, like let's say I know someone, I mean I can't name them. She told me that she works in emergency, like in a hospital in Surrey, and she's like, Kanav, you know what? Sometimes we get a call from people saying, hey, you know what? We want to see when the appointment is coming, or they have an appointment after 1 year for a specific, whatever work they want to do. ठीक है, एक साल बाद appointment मिली हुई है ना, and now she's like, I get a call from another person in emergency, or not in emergency, in a hospital saying, hey, you know what, just cancel my appointment because I think now I'm almost done. I'm almost dying now. मैं मरने वाला हूँ. Like हो गया मेरा तो काम because you guys didn't even give me an appointment. And that person died as well after 3 days.
I have a question for you.
Yeah.
Did the person was scheduled for something life-threatening?
Not live. So this is the thing. No, this is the gap. Sometimes when you call them, call a hospital, they ask you certain set of questions. It's possibly not life. Like sometimes it's not life-threatening, right? Now, what is the definition of life-threatening here? When you say life-threatening could be anything.
So before I answer your question, मैं एक चीज़ दसना चाहूँगा. I 100% agree with it. It's not a perfect system, है ना? And I'm not vouching for. I'm not advocating जो भी है.
Right.
There is a lot of room for improvement. So when you go to emergency, there is something called CTAS system. That's how they assess grade 1 to 5. ਜਿਹੜਾ person, I'm not talking about people in the community, I'm talking ਜਿਹੜਾ ਤੁਸੀਂ emergency ਦੇ ਵਿੱਚ ਆਪਾਂ present ਕਰਦੇ. We tell the nurse at the front ਕਿ ਆਹ problems, and there is a triage nurse after. So what he or she does is triage you. Grade 1 is like you're brought in by emergency crew, for example, motor vehicle accident hoya is a big one, या हुआ stroke, heart attack, chest pain वांगू है, like you're unconscious, things like that. वो CTES 1 है, that goes straight to the emergency room. He or she doesn't have to wait. Grade 2 is less severe, 3 is like even better, 4 and 5 is like you are having itching, you are having rash, you have a bit of a laceration, cut lag gaya, है ना? So they grade it on the timeline when they can be seen. So if I am the emergency doctor, I'll see grade 1 first, or CTAS level 1 first, right away. Everyone will run, reach them, do it. That's what life-threatening, or level 2. Let's say you're having chest pain. We think it's heart attack. We're going to test you, see you right away. Stroke, they go to certain hospitals. They're dedicated. Get a CT scanner right away. You go to scanner. You're seen by a doctor. You're seen by neurologist. Let's say you're in Abbotsford, Hannah. And as an example, not all hospitals,
Right.
Hannah. C-test 3, 4, 5. So that's my point is they have their way of dealing with what patient or person needs what level of care at this point. Hannah. What we are talking about is somebody has been given appointment for something else. Hannah. For example, somebody's waiting for, let's say, chronic, let's say GI issues, पेट दी problem है, is waiting to do a scope, a camera test, है ना?
Right.
Now that may not be life-threatening, but we don't know. You know my point?
Right.
Ki something is brewing inside, we don't know. He or she is waiting for test or see a specialist. Yes, there's sometimes crazy amount of wait time, which is not acceptable. Again, I'm not advocating it.
Right, of course.
But
No, I get it,
I'm
yeah.
telling you ki what they're trying to do is do the best in those level of resources. Can the resources be improved, increased? Definitely. Is there something political? Maybe. But there's a lot of money involved.
You know what? I can go into this discussion a lot with you because there's so many questions we have as a general public, right? Because what we see is what we want to ask, right? But I really want to get into aesthetics now.
Yes.
Right. I would respect your time as well. So, okay, I'm really excited about this topic because I used to think, even I was with the client the other day, a good looking client, and I was like, I'm like, you look very pretty. And I'm like, your face is so, so clear and all, right? She's like, yes. I'm like, but I don't know, like, why all these, Canadian, women, and it's a lot of Canadians, in fact, even men, not only women, they are doing this Botox, fillers. Basically, for me, these terms didn't exist before. For me, it was like, yaar, TK launde ne face te, and they are just doing it all, and eda pata nahi kinne nuksan ne and all. Menu aaya lazi. And I was asking this woman, like, tanu lade da nuksan hai? And the first answer that she gave me, she's like, kind of, what do you think? Tanu nahi lagda ki it's better than using a beauty product on the face? I would rather go for fillers every few months. They can filler beauty products se मैं पैसा खर्च करना है, so I would rather do this. I'm like, okay, that's a fair answer. I mean, I don't have a answer to this, what you just said. Explain us what are Botox, what are fillers, they are Sara, and even rhinoplasty. I mean, I just can't say on the camera, but I have so many people who went to Turkey.
Yeah.
And to get this job done. I know so many people, and they spend, and when they go to Turkey, obviously the doctors must be good there as well. Not saying that they are not, but when the Canadians go there, some of them, they are like, they're just not comfortable because they're outside the country,
North America, yeah.
right? So, and they want to do it here, but it's expensive here.
Yeah.
Let's get into what is Botox, what is filler, ਕੀ ਹੁੰਦਾ ਹੈ ਥੋੜਾ ਦੱਸੋਗੇ ਸਾਨੂੰ?
Absolutely. First of all, as you said, you started with saying ki I'm excited to know about Botox filler. I would say I'm equally excited to talk about it.
Really? Okay.
Because I love that part of the work we do.
Yeah.
Let's talk about one. Let's start from where you started. Ki hai ki, hai na?
Right.
So we're talking about different things. So again, first of all, it's a big umbrella. It's a huge business. And aesthetics is burning hot topic of the day. Turkey, they're famous because they actually started it. I shouldn't say started it, but on let's say commercial level, they advertised it really well. There are a lot of skill set there, Hana. But now it's available everywhere. Hana. Cost may be different, but again, you also want to consider key cost. We'll come to what it is again. Cost, depending on how much you're traveling to, you're paying for that too. So you consider that as well. Now, most of the services are available in North America, right? And you have to weigh pros and cons and all, your comfort level and all. Now, coming to your original question, Botox, fillers, rhinoplasties, PRP. So they're a little bit different things. But again, the goal is to make you beautiful, rejuvenate your skin and all that. Hai na? We go to spas, we go to beauty parlors, the chemicals, hai na? But this is more relatively newer thing. I'm saying relative because it's booming, it's getting better. So Botox, as you know, is एक neurotoxin hunda. Neurotoxin is like, it paralyzes your muscles. When I say paralyze, I don't mean to scare you, but it's partially paralyzed or temporarily paralyzed. How it started was Botox was produced by one of the microorganisms.
Okay.
है ना? So the extract लाके कर दे. See, nowadays, things change and they now create synthetically and all that. So bottom line is, you see how as we age, we have wrinkles, we have skin folds. To see edge of the eyes, they dekhonge, some people have crow feet lines. frown lines ਹੁੰਦੀਆਂ ਇੱਥੇ, you have nasolabial lines. You will see ki over a period of time, if you even look at your pictures, you feel like people who are in their 30s, 40s, 50s, whatever. When you compare yourself with 10 years, younger, so you will see the major differences over your face. ਤੁਹਾਡੀਆਂ lines prominent ਹੋ ਜਾਂਦੀਆਂ, crow lines prominent ho jandi hain, your nasolabial, depending on what kind of work you do, person you do, how your overall health is. So there are muscles there's very tiny muscles in our body, so mostly the face, as we say, like thousands of muscles, so the small muscle fibers. So every time we smile, frown, we use our muscles. So as they get more hyperactive, prominent, so over a period of time, or wrinkles jo those sag ho jande, you have those lines become more prominent. So what we do is, or what Botox does is, we inject those small units of Botox and just, as I said, temporarily relaxes your muscles or paralyze them. That means they're still working, but they're less prominent, and you will feel those lines are gone. Now again, this is temporary, so you need touch-ups in 3 months, 6 months, mostly 3 months or so.
Right.
So it's like going to beauty spa and getting a makeup done, but this one lasts for longer. Now, obviously everything we do, the pros and cons on there, but I would say the benefits people find are way better than having minimal amount of side effects, right? Even you take a simple Tylenol, it does have side effects, but you take what you want. If it's like something life-threatening, people won't get it done. But it's like minor things people are worried about, but people are getting more comfortable because they're worried more about their beauty. If it makes you like 5-10 years younger, you will love it.
So Botox is like a kind of injection, you said?
It is an injection.
And what are the fillers?
Fillers. So fillers also called dermal fillers. Ode vich collagen hunda. There are different kinds of them, and again, some like hyaluronic acid. There's lactate kind as well. Like a lot of them people use for different areas. I'm not going into detail again. So what it does is it gives you more volume. Jithe tusi inject kar rahe ho, it promotes collagen. So collagen again is something that is subcutaneously involved under your skin. Jeda part thonu like contour denda body. When you look at babies, they have more fat, they have more collagen. You see they're chubby and all that. They have more facial features. As we grow older, they just kind of go down. So it's like collagen upon different body parts. It can be nose, it can be nasolabial folds. Again, some people get chin contouring done. Chin and cheek, both. Similarly, nose as well. So it gives you contour. Some people, to see dekhonge, sunken eyes hondi hain. So inject those fillers, give you a fuller effect. So as thoda face because we're primarily talking about it, but there are other body parts that right. And we can talk about it as well. Jado contour denda, you feel rejuvenated, you look younger, and again the life is longer than Botox. Doesn't affect your muscles, but the contouring, obviously your body ne onu dissolve vi karna jada product ode ch paya hega ya collagen. It's more like natural. I won't say it is natural, but it's close to that. And also the body vi ode reaction de which collagen produce kar diye, which is a good thing to have. It's like give you more better look. Again, there is downtime, and there is some time after certain time, 3 to 6 months, or even sometimes longer, depending on how you are. You may need to get another touch-up done or more. It's like it's a maintenance treatment after that too. It just doesn't. It's not permanent, but it stays longer.
So when people are coming to you, what are the areas they want to get this job done? Like I know personally, I have seen so many people, they get the boob job done, right? They work, of course, they work on their face a lot. Hor ki kede areas liye tanu kehne ne ki, you know what, we want to get the job done here, kede areas hunde jithe chaਹੁੰਦੇ ਨੇ?
So as you said, ki face is the primary area people are more concerned, worried about. So ode which, as I said, well, I'll talk about face and we'll go to other areas too. Face de which, as you said, crow lines, again, we do Botox for that. People get, as I said, liquid rhinoplasty, which is like non-surgical nose job. Right? As an example, people have a dip in their nose. So we give that more profile. We inject fillers, and again, it's painless procedure. Kyunki apan numb kar dene with the cream and all, you don't feel it. It's like 20 minutes, you feel the difference right away. So we give that profiling. Even men get it done. Now some pictures I'll share with you. Girls, they like it. We have Asian noses, we have different kind of noses. Some have flatter, some are more prominent. ਕਈ ਵਾਰੀ ਤੁਸੀਂ ਦੇਖੋਗੇ from the side there is a little dip ਜਿਹੜੀ nose dip ਕਰ ਰਿਹਾ ਹੈ ਨਾ. So what we do is let's say we make it a line and make it more prominent. It's not a reduction procedure, it's an addition procedure है ना. मैं बहुत layman terms
Right,
ਗੱਲ
right,
ਕਰ
I
ਰਿਹਾ.
get it, yeah.
It's like people often compare with surgical one, which is expensive. Obviously, it's a surgery. They can have complications. This is non-surgical I'm talking about. So once we inject those dips, which we injections, and it gives you more profile, body face, the look change ho jandi. If you look from the side, sometimes there's a little dip. Girls sometimes get what we call Tinkerbell nose or a tip rise, right? After putting injections or needles or whatever, we sometimes do Botox as well, and that's a bit complicated. Very safe procedure, minimal downtime, excellent results. And it lasts longer than other fillers, liquid rhinoplasty, because a less mobile part hai. Anywhere between 6 months to 2 years.
So I even asked you the other day when I met you, I was like, okay, you want to get let's say a nose job done. So you have the nose ठीक करा रहे हो है ना. First question that comes to my mind is, okay, after 1 year, after the job is done, like it's temporary, right?
Yeah.
What happens to the nose? Does it come back to its normal shape? Do you guys do an addition to ਤੁਸੀਂ ਕੋਈ ਇਸ ਤੇ ਮਟੀਰੀਅਲ ਲਗਾਉਂਦੇ ਹੋ, right? Is there extra material added ਜਿਹੜਾ ਖਤਮ ਹੋ ਜਾਂਦਾ ਹੈ? What exactly happens there?
Great question. As I said, कि collagen है basically. मैं जो कहूँ that whatever that chemical is, hyaluronidase है, hyaluronic acid है, या जेड़ा भी आप filler use कर दें, again it is a filler है ना. So जेड़ा filler inject होया, पहली गल तो initially how it works is as I explained कि उन्हें stimulate कर दे and gives you, but you feel it right away because आप fill करती हो है ना. It is giving you that prominence or that shape and all. So over a period of time, body ने उन्हें dissolve करना slowly. Right? So once it slowly get dissolves, it doesn't mean कि थोड़ा nose back to बिल्कुल original normal आ जाएगा.
Right.
Yes, it can happen after years. So what happens is everything. You buy a car, you have to change the tires after some time. है ना? It's a maintenance work.
Right.
So you need maintenance work. Most of the time, you don't need that much of a filler. You need a touch up because जे थोड़ा एक जगह dip हो गया थोड़ा जा, we just touch it up and do it again.
Why do a lot of, I see in Canada, like why do a lot of women look the same after they do all these kind of jobs like fillers and Botox? Like their lips are same size, their face is same. Are you guys injecting the same amount of quantity on every face, giving them the same kind of look? Why are they looking all of them same? Like you look at the pictures, you meet them in personal life. All of them have like big lips. I'm not making fun of anyone here. No. But when I look at them, I'm like, okay, you have big lips, you have the face, and it's beautiful as well. I'm not saying it's not beautiful, but it's same. Are you guys injecting the same amount on every face, or does it depend on a face? Okay, this is how much I need to inject here, or this is how much I need to get.
Absolutely not. So, ki hunda hai, once you come to us as a client, for example, so again, for everything else, we have goals. So we ask, what are your goals? What do you want to look like? Again, we tell you, or we decide kinne units paane, kinna volume paane, based on what you want. Some girls are like, oh, little touch up, it should just give more better profile, no big lips. Ki tonu dekh ke pata na lage. I mean, you can obviously tell, but edda na lage ki it's too prominent, it's too much. Again, too much definition may vary from person to person.
Right.
है ना? What you want. So based on that, as we assess kar, then we're like, exactly what are you looking for? You're looking like really plump lips. We want like little touch up, little profile. You have little lips. Let's say the upper lip chota hai, you want it a little bit bigger, right? And we were like, okay, let's do this. Have a look. How do you feel? And we can always touch up and do more. Right. Again, it is based on the goals. Now, when you say sare similar look kar de, because when something trends, you want to get it done. Like as we're talking about Tinkerbell nose. Right. Tinkerbell nose basically tip odi thodi ji protruding hundi and girls like it. They love it. But again, if you like it, you get it done. If you don't, you get other things done. So bottom line hai ki what you want, we just based on those goals. So our expert advice tells you कि okay, maybe you need this much volume, है ना? वो ਅਸੀਂ decide कर दें. You don't have to worry about it. You just have to come and tell me, okay, this is what I'm looking for. It's like getting a haircut, right?
Right.
I want this.
Why does it happen when I see a lot of celebrities as well, and even local Canadians I know, they get this job done, and after a while I've seen this with a lot of celebrities, their face kharab ho janda hai. I've seen that. Right? Why does it happen? Like, do they stop visiting you guys, or or they just don't take care of themselves, or it's a side effect?
So question one, not really question, I would say कि मैं generalize नहीं करना चाहता, but yes, question is ਤੁਸੀਂ करा ਕੀ ਰਹੇ ਹੋ. Now talking about side effects, I'm not saying long term कोई complications ਹੁੰਦੀ, because it is simply collagen, as I said. Yeah, simply Botox, which is reversible. If you're going under the knife, if you're going surgical things done. Now ਜਦੋਂ ਆਪਾਂ celebrities ਦੀ talk ਕਰਦੇ ਹਾਂ, we don't know. Our information is based on what we think or what is being presented.
Right.
है ना? If they're going surgical, some people get surgical nose jobs. Again, nothing wrong with it. Everything happens to your body can leave a scar. है ना? Now, there are thousands of celebrities and they're doing fine. Because they're more prominent figures, we notice it more when we see bad results, for example. I'm not saying it's foolproof. I'm not saying it's 100% effective and no side effects. Yes, problems can occur, but it's rare. It's less common to happen. Because technologies, the chemicals have been better, the techniques have been better. Things have changed a lot, and as any other field, it's great. If it have been side effects, you're getting it done to, one of the most prominent parts of the body that are most visible. People they will stop doing it. So I'm sure there are pros and cons, and there is calculated decisions, there is research behind it. And there is a lot of research behind it. Now, will it be even better in 20 years? Yes. At this point, I think it's decent enough. It's available to common people or everyone out there with a reasonable price. Back 20 years, ਤੁਸੀਂ rarely ਸੁਣਦੇ ਹੋਗੇ, ਜਾਂ if you look at that, कि only celebrities would do it. Now it's available to everyone. The reason it's available, it means it's relatively safe. I'm saying relative again.
Right.
I mean, मैं ਤੁਹਾਨੂੰ ਉਹੀ common example ਦੇਣਾ, people can have rashes with Tylenol, but again, what do you want?
I see, I will mention this because people are were talking about Anant Ambani's, marriage and all, because a lot of videos were, going on, and people were trolling this guy. Yeah. Like, he has so much money, why he's so big, he can get his, face job done, get the fat out of the body. Okay, when someone looks a little fat or has a fat face, fat is I'm not trying to again disrespect anyone.
Absolutely.
When I say this, I mean, this is how we look at things from outside, right? When we see it, why can't people and why don't they get it done? Like, for example, or maybe he has got it done, or maybe he's going through some health problem or whatever, right? क्यों नहीं करवा रहे कुछ लोग? या let's say if someone comes to you, says, Varun, I have a fat face, like mera face vadda, but I want to get a face like Hrithik Roshan, like a long face, proper jawline. You can do it to them?
Absolutely.
You can do it?
Yeah. So let me come to it.
Yeah, okay.
I don't want to give you blanket statements.
No, I get it, yeah.
Everything we do have limitations, Hana. Yes, jawlines can be done. Yes, the wrinkles can go away. Yes, the plump can go away. Now the question is, if you're like heavy enough कि वो थोड़ा fat prominent हो रहा है, yes, we can address it. But again, body have to try to normalize it back to how you are. ਜੇ ਤੁਹਾਡਾ metabolism slow, if you're not eating good, you're not hydrating, again, whatever we do is a top up, a support to what your actual, again, this does not replaces your lifestyle.
Right.
You cannot be, again, I'm not trying to demean or be, saying bad words about people who are on the heavier side,
right,
weight-wise. Yes, you can get it done, absolutely. But how long that lasts is a question. right? You don't want to get it done and like two months, 3 months, you're back to the same. Because as we're talking about everything else like collagen, Botox, you need touch-ups, you need maintenance. है ना? If you're a heavier guy and you're not taking care of your lifestyle, for example, or you have a medical condition,
Right.
it is not gonna sustain enough. Now, talking about that, now there's another subsection of aesthetics when we give you injections in the tummy, lose some fat out there, tummy tuck seg and all that. Again, whatever procedure you get it done, doctors tells you lifestyle. You cannot like eat like whatever you're eating double cheeseburgers and all that. You're heavier and you still expect to look the way you should look. So whatever we're doing is in addition to everything else. You got to be eating good, you got to be hydrating, you got to do good skincare. So all these things are still important. We are not claiming to replace those things.
I'm just curious. So let's say someone on the heavier side comes to you, because I didn't know, okay, like you can do it on the stomach as well, like tummies.
We're not doing it right now, but we're bringing it in.
Yes. So let's say when people don't want to go to the gym, for example, and don't want to follow that, or maybe they want to follow the gym process, but let's say they come to you, they're like, okay, you know what, Varun, I have a big tummy and I want to get rid of this fat on my body. So the moment you guys do your procedure and the body is in good shape, and let's say that guy likes himself, obviously, then he starts going to the gym now, and he starts following the lifestyle process. Will he maintain it then, or will he need to come to you guys again and get those injections again?
So now we're talking about the injections we put to fat dissolve, which again, we haven't yet started, but yes, it's out there. So answering your question, so thing is again lifestyle. If you first of all, hitting the gym every day or whatever, maintaining lifestyle is hard. Let's be very honest.
Right.
And again, I'm distracting from the topic. Lifestyle means not just gym.
Right.
It's your eating patterns, and which
Absolutely.
is studies, research have shown, ज़्यादा effective है, sustainable है. You cannot beat doing gym. Even if you're a marathon runner, you're not eating healthy, you're still fat.
Absolutely.
Right?
I couldn't agree more, man. I've done it for 1 year. 80% was my good eating habits, and still.
We all know that.
Yes.
It's just a practicality is difficult.
Right. You can't control your mouth. You want to eat.
True.
You want to eat the chips. You want to eat everything.
True.
No, I agree. That's true.
So gym, lifestyle, eating is again important. Yes. So what it does is, yes, it helps you. Let's say, okay, let me put it that way. Yes, let's do the other way. You're doing gym, you're exercising, you're eating good, you lost some fat, you're on the healthier side of the weight, but you're still feeling, certain areas, nahi ja rahe, etho fat nahi ja raha, tummy fat is harder to, In that case, those are the best candidates.
Really?
The reason is
like love handles, right?
Love handles, for example.
Okay.
So people struggle ki certain areas fat hale bhi hai, flabby hai, we need more, ki let's get some addition. So those are the best candidates. I'm saying best because they're already doing all that. It's just some resistant fat, because how fat does is it goes to certain areas away first, and then certain areas are resistant and they're very hard to treat, very hard to get rid of. So those people are like, okay, let's get this done and that will help. Now, if you're doing reverse way, I agree. Well, it helps, but again, it's the sustainability that an issue,
Right. So let's say I'm really curious to know. So let's say if I come to you, I say, hey, you know what? I have the good body and everything now, but my love handles are not going away. That's a little difficult to get rid of. Right. In the gym as well, they're not going away. Varun, can you help me do that? You helped me. It's done now. Do I need to redo again to maintain it?
There is some maintenance,
Okay.
but you don't have to start from scratch like everything else.
Okay.
So again, depending on je tusi absolutely healthy kha rahe ho and your fat percentage is on the lower side, you're not gonna get accumulated next year or two or whatever. Je dobara aunde, because what we do is we go in layers. Kade we cannot be like most people cannot sustain that. Sometimes there are cheat plans and all that. You may need it, and it varies person to person. It's not that you need it like every month or whatever if you're maintaining your lifestyle.
Right. You know what? I have so many questions coming in my mind, but I'm trying to respect the time again and again.
Totally fine.
And I'm telling you, when this podcast goes out, people are going to ask so many questions, and we are going to do a second part as well, most likely. This is
We'll
what
love to
I
do
see.
it.
I also noticed that you do the, what do you say, the PRP process, you said, right? Is called PRP?
It's called PRP.
Right? So I have seen that with a lot of people I know personally. They got it done back in India, and some of them got it done in Turkey as well, right? How does it work? Is it a painful process? And I really see their hairs have grown so well, and they look like very good now. But some of the hairs, sometimes the hairs are not in the proper position and all.
Correct.
Can you tell us about that process?
100%. I love this topic, one.
Yeah. Okay.
PRP is plasma, platelet-rich plasma. So,
Okay.
in very simple word, we take your own blood. So, thode blood ਦੇ ਵਿੱਚ ਮੋਟਾ ਚਾਰ components ਹੁੰਦੇ. So, platelets is one kind of blood component. Plasma is like you have, okay, let me put it that way. You have a jug of water, you put pebbles, you put other stuff, some metal there, है ना? So, plasma is your water plus protein and all that ਚੀਜ਼ਾਂ ਹੁੰਦੀਆਂ. Platelet rich plasma is ਉਹਦੇ ਵਿੱਚ platelets is one kind of cells. So what's important is ਉਹਦੇ ਵਿੱਚ very rich growth factors ਹੁੰਦੇ, your own growth factors. Now, everything else we talked about, this is the most natural way. है ना? Natural ਕਿਉਂ? ਤੁਹਾਡਾ ਆਪਦਾ blood ਹੈ. We take your blood, we spin it in a machine, we take out that rich plasma which is rich in growth factors. ਜਿਹੜਾ ਤੁਹਾਡੀ body 'ਚ already exist ਕਰ ਰਿਹਾ. All we do is we take it out, we inject into your body depending on what we're doing it for.
Right.
Now, why I'm saying ਕਾਹਦੇ ਲਈ ਕਰ ਰਹੇ ਹਾਂ, it's like one part you mentioned is hair.
Right.
That's one part. And we'll talk about others too. Others is like for skin rejuvenation again.
Really?
Yes. We also do it medically for joint injections, which I do as well. Some sport injuries, we inject those into tendon, ligament injuries and all. Let's talk about aesthetics, the hair part first. And then, there's one more thing, P shots and O shots.
Okay.
P shot is for male erectile dysfunction. O shots are for female similar things as well. Right. Let's talk about hair first. So as I said, PRP, you know what nutshell it is. So simple procedure. Now, is it painful, painless? Yes, it's like taking your blood. You know how it feels. Now, we do numb it. Okay. Let's talk about what we do, how that helps. ਜਿਹੜੇ rich plasma ਹੁੰਦਾ, growth factors ਹੁੰਦੇ, we inject into. If you have scarce hair loss ਹੋ ਰਿਹਾ, especially male pattern baldness ਹੁੰਦੀ, even female have it.
Right.
So we inject into you, scalp ਦੇ ਵਿੱਚ, with a needle or whatever, है ना? And you need touch-ups. So for this one, you need to follow up like every month or so, right? Before you start seeing the effects. But it has excellent results. Sometimes people feel ki, okay, I have hair loss ho raha hai, hairline recede ho rahi hai. Not really there ki main hair transplant kara la. They are very good candidates. Also the good candidates, once you do hair transplant, you still need maintenance. It's like giving fertilizer or to crops, है ना? So to see rich plasma दे रहे हो and it boosts your hair follicle growth.
Right.
Hair follicle मोटे होंदे और hair मोटे होंदे, plus ਜਿਹੜੀ growth है वो भी dense हो जाती है. It has very good results. Sorry, what was the other question?
No, this was we were sharing about PRP only. That's you shared the details, but you
Painful or painless?
Yes.
So yes, well, I tell people that there's no pain, there's no gain. Yes, it's a little uncomfortable. We have different ways to make you more comfortable, Hana. Sometimes we do is put a numbing cream, like way stronger cream, and numb the whole scalp and do it. Jada vi procedure, jitne vi kar rahe hain. Like scalp, I'm saying head because we're talking about hair.
Right.
Some people prefer ki don't put it, just do it. It's like take 5-10 minutes, you inject it, and you're done. Okay. When you think about needles, people feel, oh, bahut sari pain hai. Again, it varies what kind of person you are. Je bilkul numb karke nahi bhi kar de, and again, I do it with numbing, but it's a preference you do. Hair scalp de vich there bahut sari nerve endings nahi hundiyan. Yes, it's not as painful as compared to you do something on face. So some people are still fine getting it done without numbing, but it's a choice. We do it both ways. Wow. It's uncomfortable, but no pain, no gain.
But coming to another question is, okay, like Botox and fillers, the PRP process also has side effects. like okay, you said Botox and fillers have side effects of in any hunde like limited, right? But does this process also have side effects, or is this like a natural thing? Okay, because you're taking it from the body and you're putting it again, like
So commonest thing people feel is obviously we're injecting you with needles, a little bit
Yeah.
of a bruising, a little bit of a pain. Yes, you put yourself, ਜਦੋਂ ਤੁਹਾਨੂੰ poke ਕਰਦੇ you put yourself as risk of a little bit of infection, है ना? But it's natural, your own body, ਤੁਹਾਡਾ ਹੀ blood ਹੈ, ਤੁਹਾਡੇ 'ਚ ਹੀ ਜਾ ਰਿਹਾ ਹੈ, but it's helping. Now those small things are manageable because we clean it really well. We tell you कि ਕਿਹੜੀਆਂ precautions ਲੈਣੀਆਂ. Most people do fine. If your immunity is fine, they rarely have
you know, I have a
problems.
funny story to share. I have a doctor friend I can't even name. He's here local, like in BC only, and he said, "Kind of, he came from India, and he's like, and he didn't show up for 1-2 months. He didn't show us his face and all, right? And then he meets me after a few days, and he's like, "Do you notice something?" I'm like, "Yeah." I'm like, "I don't notice much. Like look at me closely. Look at my hairs. Like, do they look dense?" I'm like, "Yes," but I never noticed they were not there." It's like, that's the trick. It's like people go to doctors when they are bald. You should go to the doctors when you're not bald so that people don't notice.
Very important.
I'm like, this is something, this is funny as well. वो कह रहे कि जे मैं गंजा ही हो गया ਤੇ ਮੈਂ ਜਾ ਕੇ ਬਾਲ ਲਵਾ ਲਏ ਤਾਂ ਸਭ ਨੂੰ ਪਤਾ ਲੱਗ ਜਾਣਾ.
Yes.
He's like, ਮੈਂ ਬਾਲ ਪਹਿਲਾਂ ਹੀ ਲਵਾ ਲਏ ਜਦੋਂ ਮੈਨੂੰ ਪਤਾ ਲੱਗਿਆ ਕਿ ਮੇਰੇ ਥੋੜੇ ਥੋੜੇ ਜਾਣ ਲੱਗ ਕਾਫੀ ਸੈਂਟਰ ਜਾਣ ਲੱਗ ਗਏ. Like I got the job done and I feel good now. I'm like, bro.
Absolutely. Again, as I said, it's more maintenance than treating, right? So maintenance is usually easier than actually treating you. Obviously, more money involved. है ना? So I 100% agree.
Right.
ਜਿੱਦਾਂ ਮੈਂ ਤੁਹਾਨੂੰ ਦੱਸ ਰਿਹਾ ਸੀ, some people think, oh, ਮੈਨੂੰ ਹਜੇ ਲੋੜ ਨਹੀਂ transplant ਦੀ, right? And you should still get it done if you're already thinning hair. ਤੁਹਾਡੀ hairline recede ਹੋ ਰਹੀ. And again, sometimes it's genetics, sometimes it's your lifestyle is that, है ना?
Right.
है ना? It can be both. But you don't have to wait until कि सारी, hair you're losing, है ना?
Right.
More hair follicles you have, the better the chances. है ना? Existing hair ਨੂੰ ਆਪਾਂ basically support ਕਰ ਰਹੇ ਹਾਂ. And it is stimulating to other hair follicles anyways, है ना? You do not have to wait until everything is gone or most of it is gone.
But what is the time? Okay. This is भले मेरे questions बहुत ने पर
No
मैं
worries.
थोड़े ਜਿਹੇ cut ਕਰਨ ਦੀ ਕੋਸ਼ਿਸ਼ ਕਰ ਰਿਹਾ ਹਾਂ. Let's come to the pricing of this, right? How is the pricing of Botox? Did we cover all of them? Like we spoke about Botox, we spoke about fillers, we spoke about Rhinoplasty, we spoke about the PRP process.
Thread lift, did we talk about it?
Let's talk about it. What is thread lift?
Thread lift.
What is that? Okay, tell me.
So we do thread lifts, which is like, so basically what we address is, some people are like, okay, Botox is one level, fillers, then we do again fillers, they help with the sagging skin, but mostly sagging skin ਜਦੋਂ ਬਹੁਤ sag ਹੋ ਜਾਂਦੀ after a certain time, you need a little pull. How girls or even men get it done nowadays too. So what we do is again, we numb your skin. There's a point in up your face or up your, somewhere around the temples here. So the neck karke, just with the needle, we inject or put a thread. So basically thread hunde, they're more like collagen threads. There is a material that comes in. So we put that in, we pull your skin up. It may feel invasive, but this is even safer than fillers when we compare. है ना? Excellent results. ਤੁਹਾਡੀ ਜਿਹੜੀ whole body contour ਹੈ and get pulled up. People who have sagged skin, they're the best candidates. So we put threads here. So ਉਹਦੇ ਵਿੱਚ clogs ਹੁੰਦੇ ਆ thread ਦੇ ਉੱਪਰ. It's like a long thread, few centimeters. We inject, put it from here through a cannula. Like there is a straight needle. It goes, obviously it's under numbing and people don't feel it even.
Right.
So we pull the skin, you feel the results after certain days, but it lasts way longer. Last up to 2 years. There is some downtime we want you to take certain precautions, which we can talk about later,
Right.
or we talk to them personally too. है ना? Excellent results. Again, that stimulates collagen, but it gives you like that pull up there, because sometimes there is limitation for fillers ki tusi onu certain extent tak sagginess nu correct kar sakte ho. But that's like you still that perfect chiseled face sometimes. Those are thread lifts.
Wow.
Yeah. And we do that as well.
Amazing. थोड़ा यार दोस्तों, can you talk about the pricing a little bit about all these procedures and also the maintenance pricing as well? Because what I see a lot of people do is they hear, okay, everyone is doing it, let me get it done. But they cannot maintain it because of maybe they don't have enough income coming all throughout the years, right?
Yeah.
So let's say if I come to you, say, hey, you know what, can you do this on my face? I get it done once. I have paid you one amount now. Now I want to maintain it. Now this is my lifestyle as well.
Yeah.
Because I want to do the maintenance, right? How much is the maintenance charges after the original charges? Like overall, can you break it down?
So I can give you a range.
Range.
Right. And again, it's like let me put it that way. It's like we have how we work is we do a consultation and we look at what your goals are, as I said, है ना? फिर ਤੁਹਾਡੀਆਂ needs ਕੀ ਹੈਗੀਆਂ, how many units you will need, how big the work is, है ना?
Okay.
And how much actually products we have to use, है ना? Now, nutshell Botox units count as, it varies in this area about 6 to 8 units. I'm not quoting my, rates and all that, but per unit, how many units we use on you, right? And all those. So we calculate and tell you that, है ना? Maintenance, again, number of units, कितना volume देना तो fillers दा ओदे ते vary कर दिया, right? So there's, again, giving you again, some people get it done too much, some people have bigger plump lips, as we were talking, है ना? Nose jobs start at about $900 Canadian. Again, sometimes we give some discounts if you get a package and stuff like that. That's roughly what we're looking at. PRP varies anywhere between $350 to $900. P shorts are about the same range as well. The thread lifts are a bit pricey. They start from about $1,800, $1,500 to up to $2,500, depending on how many threads we have to put
This
in.
is one
This
time?
is the thread lift we're talking about.
Right.
Mostly one time, but again, it lasts way longer. Some people may need touch up. Now, the maintenance is like you're still getting a job done
Right.
afterwards, and we calculate, you may not need enough or as much ਜਿੰਨੇ ਤੁਹਾਨੂੰ ਪਹਿਲਾਂ ਲੋੜ ਸੀਗੀ, because now you're doing more touch up. Now, again, it's still sometimes people end up, again, your metabolism is higher, ਜਾਂ ਤੁਹਾਡੇ ਜ਼ਿਆਦਾ dissolve ਹੋ ਰਹੇ, ਜਾਂ you're coming late, you may end up getting more units then as well. Now, it's how much product we use, how much work we have to do. All those factors are important. Now, I'm not giving you I cannot give you exact, quotation, because
Right, of course.
it depends on what you want, huh?
It's customizable.
It's customizable, exactly.
Right. Okay, perfect. Many people might not know how we know each other. We met through a cricket team in Chalawak. So we play cricket together, and it surprises me. I would have never known that you were a doctor. Actually, people like in ਆਪਾਂ ਜੋ ਖੇਡਦੇ ਆ ਸਾਰੇ ਕਹਿੰਦੇ ਸੀ okay Dr. Varun ਨੂੰ ਬੁਲਾਓ. I was like okay, but ਮੈਂ ਉਹ ਸੋਚ ਨਹੀਂ ਸਕਦਾ ਸੀ because when you're playing, you are not you're just playing as a friend ਵਾਂਗੂ ਖੇਡ ਰਹੇ ਹੋ.
Exactly.
But,
It's a good team.
Yeah, it's a good team. It's a amazing team we have. What factors should someone consider before they want to get the rhinoplasty? Because I really wanted to know for someone I know that okay, you want to get the nose job done. Upper temporary, like first you go for a non-surgical one.
That's right.
How long does it last first of all? You said 1 year?
So anywhere between 6 months to 2 years.
6 months to 2 years.
The reason is because it's a less mobile part and it stays there for longer. And then sometimes people need touch-ups.
And you can do this, you can continuously do this instead of getting a surgery?
Absolutely.
You don't need a surgery,
Yeah,
right?
because most people, if you see 90% of the people, they don't have very big deformities. Unless your nose is very crooked and all that, you need surgery. And your septum is like other side, huh?
Right.
That's a totally different story. Most people have little humps, their tip is going down. But again, a little bit of a change in that we do. It's like art, right? It's like canvas. Your look changes.
But ਜਦੋਂ ਆਪਾਂ ਕਿਸੇ ਦੀ ਨੋਜ਼ ਦੀ ਸ਼ੇਪ ਨੂੰ ਚੇਂਜ ਕਰਨ ਦੀ ਕੋਸ਼ਿਸ਼ ਕਰ ਰਹੇ ਹਾਂ, ਉਹਨਾਂ ਦੀ breathing, like they don't have, like always I was concerned. I'm like okay, if I change or if someone changes their nose, ਤੁਹਾਡੀ breathing issues ਨਹੀਂ ਹੋਣਗੇ ਤੁਹਾਨੂੰ?
Good question. I'm glad you brought it up. Huh? Obviously, as you know, I'm a trained doctor and I work with medical part of it too.
Right.
So aesthetics to which we're not going inside. What we're doing is working on your bridge. Thoda ja deep jana. So how the anatomy looks is, you have a major bone which lasts like mid tak aandi hai, and you have cartilage around. Jada soft part is more cartilage. This part is more collagen, soft tissue and all that, ਜਿਹੜਾ ਤੁਹਾਨੂੰ prominence ਦਿੰਦਾ ਤੁਹਾਡੇ ਵਿਚਾਲੇ ਇੱਕ wall ਹੁੰਦੀ, that's called septum. So this part we see is bridge of the nose. That's just like tip of the iceberg.
Right.
So we work primarily on this and the tip, the cartilage here. We do not go inside. We never go inside, right? Andar wala breathing part no, we are not touching your cavity, the nose cavity ਜਿਹਨੂੰ ਕਹਿ ਦਿੰਦੇ, we're not even touching it. So we're very superficial, but that's the part most people see. That's the beauty part. Andar wali anatomy ਨੂੰ ਆਪਾਂ ਛੇੜਦੇ ਨਹੀਂ, we don't touch it.
Surgical or non-surgical?
We're talking about non-surgical.
Non-surgical.
Now, surgical, there are a lot of options and treatments. Now, are you doing the aesthetic part? They still have to move your septum and take cartilage and insert it here. They have to sometimes go from watershed areas here. Again, maybe it's a bit more detailed.
Right.
But yeah, that changes your anatomy a little. Should it still affect your breathing? Mostly not. Huh? But again, if you're going under the knife, it's a bit riskier than getting an injection in your nose, which is one, your downtime is less. Compare it with the surgery. Still, end of the day, it's a surgery. I'm not saying surgery is not an option, but I would personally, if you ask me, it shouldn't be my first option. Now, कुछ candidates होंगे clients whose option is that only.
Right.
है ना? But as I'm telling you, most people are okay with getting liquid rhinoplasty or non-surgical nose job. And answering your question, it doesn't affect your anatomy inside.
No. And what is the rough range? If you have to give a range, okay, kind of this is the range for a non-surgical nose job.
For money, you mean?
Yeah.
Yeah,
What is the price
roughly
range?
around $900.
That is actually not much, I will be honest. For 6 months to 1 year.
Up to 2 years.
Up to 2 years. ਇਹ ਜਿਹੜੀ procedures ਨੇ, especially the jaw lines, you know, I see a lot of Koreans and Asians, they have like, you know, the skins, they're so, you know, they're so clean, ਕੋਈ ਇਹਨਾਂ ਦੇ ਝੂਰੀਆਂ ਨਹੀਂ ਹੁੰਦੀਆਂ, whatever we call, right? ਆਪਣੇ ਲੋਕ ਜ਼ਿਆਦਾ ਕਰਾਉਂਦੇ ਨੇ ਇਹ ਕਿ Asians ਵੀ ਕਰਾਉਂਦੇ ਨੇ. I see like Korean skin is like the perfect skin. Like I have seen a lot of people have a hype about, we want the Korean face. Like ਉਹਨਾਂ ਦੀ skin ਚਾਹੀਦੀ ਸਾਨੂੰ.
Okay. Answering your question, now it's popular.
Yeah.
People get it done everywhere, no matter what ethnicity you belong to. Yes, there is a difference ki where you belong to, kedi ethnicity hai, you may have better skin because genetics, right? Some people by default, like you're saying Korean, Chinese, some people have like by default very good skin. Again, within ethnicities there are differences. Even apna people, or you know, they have some of them like very good skin, some are like crappy. And again, it can be either genetics or kinni tusi care kar rahe ho. Now coming to ki kaun karanda hai, kaun nahi, it's a personal choice, but it's very popular. A lot of girls, a lot of men, they do it now because it's longer lasting as compared to, let's say, going to a like getting a makeup done, है ना? So this is, again, it stays in your system. It's more at the molecular level. It's not just adding a layer, है ना? So yes, it has great benefits. It helps you in the long run. Obviously, ਜਿਹੜੀ ਚੀਜ਼ ਤੁਸੀਂ maintain ਕਰ ਰਹੇ ਹੋ, it lasts longer. Basic principle. So people are getting aware. Now the barrier used to be like, oh, it's only for celebrities. Not anymore. If you love your face, if you love your body, like you hit the gym, you eat better, you want to maintain your face as well or your body as well, huh? And there's no, I mean, what's the problem with that?
I know, you know, the doctor told me I was a little heavy on the heavier side and I had a back issue, major back issue. And this doctor told me, I was actually complaining to him. I was like, you know what, I don't feel comfortable. He said, okay, because when you keep complaining about your health, what would a doctor do? They were like, okay, here you go. These are the painkillers. Take them, right? But I'm like, can you advise me something? Not the painkillers, because I don't want to have the medicine and all. I'm the last person who would want to have any medicine, right? I do not want to eat any medicines. He said, the only thing I can suggest you is a good lifestyle.
Absolutely.
You need a good lifestyle. I'm like, okay, can you elaborate it? What is a good lifestyle? He's like eating habits, going to the gym, walking, exercising, you know, mindset. He's like, that's a good lifestyle. I'm like, that's it. Thank you so much. And I really understood that right away from the doctor.
Yeah.
So instead of taking those medicines and, you know, going for that thing, I was like, okay, this is the advice I would want to follow.
Absolutely.
And I think people should really understand this.
100%. So kind of the problem here is, I mean, you took it like, okay, this is advice, I'm going to follow it. Huh?
Right.
One, let's be honest, as I said, it is hard. It's easier for a lot of people, oh, give me the pill, I'm okay. Again, this is what you want. Obviously, everything you use in your life has its pros and cons, has side effects, like medications.
Right.
Again, this is what we already know, and a lot of people already know healthy lifestyle is important. But to implement is the hard part, and it needs a lot of motivation. And again, I'm saying that's the best way to do it. And again, medications come after.
Right.
Hannah? Again, I'm not trying to be a guru preaching stuff there, but we all know, but we don't implement everything that's out there.
True.
Information hegi hai. It's nowadays information, knowledge the coming. It's just how are you putting in it in your lifestyle. A lot of us don't want to, or they find it hard to do it. So we look for shortcuts. A lot of us we do, but yeah, lifestyle is lifestyle. It is important.
Nahi, thank you so much to see. I really appreciate it.
Thank
and
you.
I think I really wanted to get into your doctor side as well. The other side, when I started with you, I really want to talk about it more with you. But then I really wanted to talk about this part as well, the aesthetic side.
Yeah.
But I think we should do another one very soon.